Welcome everyone to our third session of the Building Healthy Strong Communities virtual conference. Thank you so much for joining us here today. We are going to get started in a couple minutes. I just want to give everyone a chance to join the webinar and get settled in. But before we begin, a few housekeeping notes. So if you are here to receive CEUs, please make sure that you stay for the full duration of the event. We will be here for an hour and a half, and you need to stay from start to finish to receive those CEUs. You will receive an evaluation from our continuing education office in about a week that you will need to fill out, and then you'll receive your certificate of CEUs. We also are going to be launching a few polls during today's presentation, and I need you to respond to those polls in order to receive your CEUs. If the poll does not work for you, just go ahead and put your answer in the chat. So before I pass things on, I am going to launch a couple polls just to see who we have in the audience today. So here is the first one. And just make sure you respond to get those CEUs. Okay, and here are our results. So it actually looks like most people are none of the above. Very interesting. We have quite a few retired alumni. That is pretty typical for these types of events. I always love having our alums come back and keeping their license up to date even once they are retired. Okay, we have one more poll. So while you guys are responding to that poll, once we are finished, I'm going to pass things on to Miriam Conley. She is an alum of the School of Social Work as well as the president of the Alumni Board of Governors. She will be introducing Sarah. And just to ensure that you are in the right place, this is the third session of the Building Healthy Strong Communities virtual conference, Aligning Social Work Practice with Integrative Health. All right, give you guys a couple more seconds. All right, it looks like we have mostly practitioners by a pretty wide gap. So thank you for joining us. I am now going to pass things on to Miriam Conley to introduce our speaker for today.
Thanks so much, Emma. Hello, everybody. I am so honored to be introducing Sarah today. Sarah is a clinical social worker with 15 years experience working as an individual therapist and care management coordinator at the Ann Arbor VA health system. Sarah is nationally trained in evidence-based psychotherapies for post-traumatic stress disorder and is also a registered yoga teacher and a level 1 iRest meditation teacher. Sarah is really interested in post-deployment health, women's health, and utilization of CIH modalities as adjunctive to care for people living with complex healthcare needs. So please join me in welcoming Sarah Richards.
Hi, everybody. That is me. I'm gonna just take a moment to share my slides with you. And if Emma just wanted to let me know if that worked out okay, because now I can't see the slides. Okay. All right, so this is me, Sarah Richards, clinical social worker here at the Ann Arbor VA, and I'm going to talk with you today about aligning social work practice with integrative health approaches. And Emma and I had talked yesterday about how to manage questions. Feel free to drop questions into the chat and we'll get to them as we can. My guess is we'll probably not fill all of 90 minutes, but we might. So we'll have plenty of time to hopefully address everyone's concerns, comments, questions, and suggestions. So I had quite a lofty list of objectives today. Really wanted to just run through those for you. The goal of today really is to help to define two complementary and integrative health approaches. So CIH is shorthand for complementary and integrative health, which used to be referred to in the field as CAM, complementary and alternative medicine. So if you're not familiar with CIH, know that it replaced CAM as the acronym. And of course, in VA speak, there's lots of acronyms, so hopefully I won't inundate you with those today. Identify how those approaches can align with social work code of ethics principles and standards of practice. Understand why complementary and integrative health approaches fit well with a population living with complex medical and mental health concerns, namely our veteran population. Learn a method to change the conversation during client, patient, or system engagement. This is not something that has to be just for those who are engaged in individual practice. It can also be a systems approach. The VA is engaging in a process to change our system of healthcare, and we'll talk a little bit about that. And this is one way to do that for ourselves and for the people we're working with. Identify at least one way complementary and integrative health approaches align with action for social justice. So hopefully if you can walk away with anything, you understand that yoga is a social justice and social, a tool for social justice and social engagement in our world. In experience, we're going to take an ending with experiencing a brief yoga and meditation practice to use for your population or for yourself or for your agency. So we'll end the practice with a little bit of movement. One thing before we get started, before you even respond to this first poll, a couple things to keep in mind. Usually when I talk about complementary and integrative health and whole health in general, I want to offer up an opportunity to be as present as possible. And that might mean turning off phones or not attending to email, really kind of getting into that space of mindfulness approach. So being present in the moment with me and without judgment, knowing that I am also always learning and always growing. Despite a number of years of experience in the field, I've got plenty more ahead of me. And so if I say something and it might be offensive or concerning to you, just know that it comes from a space of where I'm at in my learning process, and I'm always open to the thoughts and beliefs of other people. So we'll go to the first poll. What is yoga? I'll just take a moment to let everyone get their responses in for that. And hopefully by that time we're done talking, you'll have a sense of what yoga is. Many people in our country, yay, look at that. There we go. See, that's awesome. It is all the things. Oh, I clicked off. Okay, so what is yoga? So these are just some quotes I pulled from different people who can influence the path of yoga. One is Patanjali's, one of the Yoga Sutras. The conjunction of the seer with the seen is for the seer to discover his or her own or their own true nature. Yoga is essentially a journey inward. That is Rolf Gates' quote. Rolf Gates is a Army Ranger, now yoga teacher and influencer in the realm of yoga. And yoga exists as a way to connect us all, dissolving separation within and without. And that is from Susanna Barkataki, who wrote a really awesome book this last year about embodying and engaging in yoga's roots. And we'll talk a little bit about that later. So, and I realize that we all come with this into this space with our own level of knowledge. And when I went through yoga teacher training 5 years ago, my yoga teacher told me, I'm going to teach you, that go through this 200-hour yoga teacher training, but that might be a freckle of knowledge that is a part of the process of understanding what yoga is and how it can be integrated into life and into care. And so I want you to know that maybe that might mean you walk away with, I don't know, a 50th of a freckle over the course of this talk. So, and you might already be well-versed in all of this already. So know that I know that that's a possibility too. So there are 4 types of yoga. Bhakti yoga, which is the yoga of devotion, which might be a kirtan or yogic festival, music, meditation practice. Raha yoga is the royal path, which is often described as the yoga class, the asana practice. Karma yoga, which is selfless service, which also might look like volunteering, philanthropy, time in military service, or the volunteering or philanthropy that you might do in the work that you do. And Jnana yoga is the yoga of knowledge. So understanding the philosophy, reading books, understanding the history, the lineage, those kinds of things are related to that part of yoga. Just recently, it came to my attention. I'm reading Rachel Ricketts' Do Better spiritual activism book. We'll talk a little bit about that later, but she enlightened me to the idea that Kemetic yoga, which originated in Egypt or Africa, is said to predate yoga from India. What is known about the lineage of yoga in India is that it was just the lineage is that Patanjali, who was a scholar and a yogi, some also say he could have been a physician, wrote the 196 Yoga Sutras and lived around 500 to 200 BC. So clearly a very long time ago. And the sutras or threads are those pieces of wisdom that can be guidance on a way of living and being. When I teach yoga here at the VA and out in the world, I focus a lot on the 8-limb path of yoga. Asana practice, which is really what we know as the movement practice of yoga, very familiarized in terms of our culture in the Western world. But oftentimes we miss that there are all other 7 limbs that are a part of the yoga path, and the focus initially, if we're moving from 12 o'clock top clockwise, the first are the yamas, the 5 moral restraints. And I will use the English translation here, which are nonviolence, truthfulness, non-stealing, moderation, and non-hoarding. And oftentimes we'll interweave those in the lessons of how we might see those things present themselves in our lives, especially in terms of mental health recovery, how we might stand in our own way in some ways, or how we might feel hopeless to our situation, and what are the ways in which we might welcome a conversation or a journey with those restraints, with the observances, purity, contentment, zeal or austerity, self-study, and the devotion to a higher power. And those also, again, will interweave into lessons about how that might show up physically, emotionally, and spiritually in everyone's life. The asana are the physical postures. Pranayama is the mindful breathing. And I'll often say in our yogic practice that if you can breathe, you can do yoga. That is the way in which I perceive yoga, and that is a way in which we can move our bodies, even if we are alternatively able. The limb of pratyahara is this sense of turning inward, withdrawing the senses. Dharana is concentration. Dhyana is meditation. And then Samdhi is union of the self with the object of the meditation. So the seer with the unseen. And the idea with that, a lot of times my translation of that for my veteran population is to think about how we can get out of our own way, how our egos can sometimes take over, albeit they're important. Like our ego is important, it gets us out of bed in the morning, but oftentimes that might be something that is standing in our way of being able to live our life fully and completely. Many people, there are many different styles of yoga. These are just some that are probably more well-known and popular. Hatha, the practice of balance. It's a traditional yogic path that's usually, the movement is surrounded by the sun salutation. Iyengar yoga, which is really popular in this area, especially. BHSC Iyengar actually practiced and taught in Ann Arbor years and years ago. And that involves a precise alignment and holding of the postures for prolonged periods. Kundalini, a traditional system of yoga designed to awaken creativity and personal power. Bikram yoga, hot yoga, performed in a hot room. And Ashtanga or Vinyasa yoga, which is translated as flow. This is a traditional Ashtanga practice is 3 hours usually. Many classes that I've attended to are 90 minutes. And there are different phases with each of those practices in terms of prescribed movement. I could just pause for a minute to see what might be going on in the chat. If any questions have popped up, Emma, just feel free to interrupt me and I can take a question with regard to the yoga piece.
No questions yet.
Okay.
I'll let you know if we get any.
Okay. So iRest is a type of meditation practice. And often is this the case with things related to appropriation of complementary and integrative health approaches. Richard Miller, a psychologist, adapted this into a protocol in the early 2000s to offer to military bases and treatment facilities. He really wanted to make it more accessible to the veteran and military population, and this was a way for the DoD to get on board. The I is related to integrative, and that small I, it came out around the same time as iPhones did, and so that was another way for him to make it relatable. But it really is based off of Yoga Nidra, which is awakened sleep, and that is, 4,000 years old, plus years old at this point. So that is oftentimes people can relate to that as the Shavasana practice in yoga, where you have the opportunity for mind and body and spirit to integrate. It helps you discover that state that exists between sleep and wakefulness, where deep healing can take place. What is known about Yoga Nidra is that 1 hour of Yoga Nidra practice is similar to 4 hours of rested sleep. So if you are in sleep debt, Yoga Nidra or integrative restoration can be a really nice practice to help with that. The premise of iRest is that you are whole and complete as you already are, that we are not broken, that we are not damaged, that we are not defined by our thoughts or our beliefs or our diagnoses or any of those things, that we show up and are who we are, and those other things are messengers that come into our purview and into our existence, but they don't define who we are. The initial foundation of the practice is to connect with intention and heartfelt desire. And that is, we'll talk in the next slide a little bit about what each of these terms means. Your inner resource, which is a subjective space of calm and ease. And the process of iRest is to move through a body scan, breath awareness, welcoming feelings, emotions, beliefs, joy, and pure awareness of being. And there has been strong evidence over the course of the last 20 years or so since Richard Miller made this into a protocol with military and veteran populations. Also, it's been utilized in homeless shelters, in the prison system, in schools, to decrease depression and chronic pain symptoms. If you're familiar with the yoga koshas, or the layers of sheath, the layers or sheaths of our existence, this is those feelings, emotions, beliefs, joy, pure awareness, all of that is a part of those koshas. So there's Annamaya kosha, which is the physical body, pranayama, which is breath or life force, manomaya, which is mental body, vijnamaya, which is the wisdom body, and anandamaya, which is the bliss body. So all of us have these layers, and all of us have these parts of ourselves, and this is an opportunity to connect with each of the pieces and make that connection. In iRest teacher training, the the introduction for me and what resonated the most is this poem by Rumi, The Guest House. So if you think about engaging in this practice where, and I'll just read the poem for you, where this being human is a guest house. Every morning, a new arrival, a joy, a depression, a meanness. Some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they're a crowd of sorrows who violently sweep your house, empty it of its furniture, still treat each guest honorably. It may be clearing you out for some new delight. The dark thought, the shame, the malice, meet them at the door laughing and invite them in. Be grateful for whoever comes, because each has been sent as a guide from beyond. So in this practice, there's an initial state of relaxation where you set intention, which is what you might want to get out of the practice or out of your day, or it could be related to a vision of how you might want to live your life. And that intention is an ally to support your heartfelt desire, which is what you might want more than anything else in this world. And that could be for yourself or for another or for the world. And that inner resource is that place of space of calm and ease. And so oftentimes people will say, like, what is your happy place? Over the course of the years that I have been practicing and teaching iRest, your inner resource can be all sorts of things. It can be any number of things. And if that's something that is not present in one's life in terms of ever thinking of a time where you've had calm or ease, depending on life circumstances, it could be a memory from very early childhood. It could be a commercial that you see on TV or a picture that comes across your screen that embodies the sense of calm and ease. So it doesn't always have to be a lived experience in order for us to access it. And then the sheaths, the koshas, are each of these other layers. So you initially call in body and breath sensing, observing sensation, observing the breath, and then calling attention to feelings and emotions, observing the opposite. So oftentimes we might have a really loud sense of anger or irritability, but it's important to note that there's always an opposite. There's always, even if it's just a little less anger or a little less irritability, that can be the opposite as well. Then calling into attention our beliefs and their opposites, and this sense of joy as our birthright, that it is something that is inside of all of us, and oftentimes it's just waiting to be accessed or invited, and we don't have to do anything to earn it. And then there's the layer of witnessing or pure awareness, and I often describe this as thinking of yourself as the sky, and your emotions and thoughts and beliefs are like the weather. And the idea is that you build this transitory sense of things. We perceive that sometimes things stick and stay, and that we can also see them move through, like clouds or sunshine or storms or hurricanes or tornadoes. But that doesn't change that we're still the sky. And that doesn't change who we are. And then you work on just addressing that sense of integration and then welcoming back the initial foundation. So here is our poll question for iRest, true or false?
And while you guys are answering, we do have a question, Sarah.
Okay.
Do you consider what many people call meditation sitting? Do you consider that yoga?
I do. I do. It is part of the path, and it is not necessarily separate. And I also would say you can practice it. I will talk about iRest this way too. It's like a Dr. Seuss book where you can practice it sitting or standing or laying down against a wall or the floor or a chair. It's just not a good idea to practice driving. And the same goes for meditation. What I do like about iRest more than other meditation practices that I've come across is that Instead of feeling like I have to put my thoughts on a cloud and watch them float away, or on a leaf on a river, I can just be with what is, and that's okay too. So there's no right or wrong way. Ooh, we're waxing and waning in terms of attention. All right, so here we go. Every time I click on that, it comes off. So what does this all mean in terms of social work code of ethics and yoga and meditation? Certainly I've run into this in my position as to, what is in my scope and what am I allowed to do. And I think a lot of that just goes with education about what yoga is and what it has the possibility to do. And there's also precedent. So I wasn't the very first social worker or therapist to say I want to do yoga. Many practitioners decide that this is a piece that's missing in our line of work, and it can help to integrate mind and body and wellness into the discussion. And if we focus on, I lifted this language straight out of the NASW. So if we focus on our primary mission as social workers to enhance human well-being and help meet the basic human needs of all people, what better way than by providing an opportunity to connect with this idea that you're whole and complete as you already are, and how you show up in this world is valid and important and necessary. And we're here to promote social justice and social change. And a lot of times, especially in the work of mental health, it's an isolative process. It is one where a lot of people feel alone, and when they can feel connected to something, again, for veterans, sometimes there's this piece missing of their identity of having a mission and goal with their time in service, and that changed mission and goal when they're transitioning into civilian life. And I think we do have a mission to be able to connect people in addressing the social injustices of our institutions and our environment and our communities, and how yoga and meditation can connect us with what is at our core. So as far as core values, and we'll come back to this towards the end of the talk today, but core values: service, social justice, dignity and worth of the person, importance of human relationships, integrity, and competence. So as that relates to yoga and meditation with a value of service and our principle to help people in need address social problems, this type of practice can encompass a lot of different things in terms of allowing people to meet people where they're at and help address their concerns and help them live full and complete lives, while also paying attention to the person and the environment and the factors that might contribute to why that is not possible, and how to address those barriers. Social justice: social workers challenge social injustice. We're here to pursue social change, and part of that is to sometimes be the advocate for vulnerable and oppressed individuals. But I will also say, what I have learned is that I came into this field feeling as though I needed to be the expert. And what I have come to know is that the people that I'm working with are the experts in their lives. And oftentimes what we're taught in school doesn't necessarily fit with that intention of being a partner and facilitator of change, versus feeling as though like we have to have all the answers and we have to be the experts in all the things. It's really showing up and listening and being present. Value of dignity and worth of the person. So what has been beautiful is to watch these relationships where people might be really isolated in terms of social isolation or avoidance, and watching, especially before COVID, watching natural relationships and supports take place, and watching that happen in the context of a yoga class. And the beauty of that, when you're thinking that there are people who are coming into this, this group environment, all with very similar baseline, like they'll joke, like they'll say like, well, we're all messed up here. Like we all have mental health diagnoses. So they understand that there's something that connects them, but then they can go deeper and build greater connections across age lines and class lines and across eras in terms of service. And in the value of importance of human relationships, recognizing the central importance of human relationships and what can unite and encourage connection versus perpetuate division. And I would hope that we also see this alignment with social work ethical standards and these responsibilities that we have to the people and communities that we're serving. Our primary responsibility is to promote well-being. That involves encouraging self-determination, assisting in identification and clarification of goals, that we gain the skills as practitioners and the training in the area of practice that we're going to be working in to provide those skills and protect clients from harm. And that we're doing so with a culturally sensitive lens and gaining the knowledge and nature of social diversity and oppression. So what does this all mean? What is complementary and integrative health's interaction with specifically the veteran population? You know, the Veterans Health Administration is the largest socialized healthcare system in our country. Certainly, many would argue that it's also a system of patients who might be presenting with the most complex health and mental health concerns that we are aware of. And so if we look at the numbers, if we look at disease category and when people come into care, you can see where things fall in terms of concerns that people might have. So this is looking at a snapshot of cumulative data of those who have served since post 9/11 and presented for care, which is actually a larger population of people seeking care, mostly because of the Affordable Care Act and the ability to get health insurance post-deployment, well, healthcare coverage post-deployment for up to 5 years from your discharge date. And so we've seen a larger influx than ever before in terms of era of veteran who's seeking care. But these are the concerns that they're coming with. And the bolded concerns are all those that are related to things that yoga may help to address. So yoga is a all systems approach, musculoskeletal systems, the connective tissue, mental health disorders, diseases of the nervous system and sense organs, diseases of digestive, respiratory, and circulatory systems. And if we look specifically at those returning veterans from post 9/11 era, the three most common diagnoses for those veterans seeking care and accessing care are musculoskeletal ailments at 63%, principally joint and back disorders, usually related to having to carry 100+ pounds of equipment on your back for however long you might be in service, let alone exercises and all the other things that are completed with that equipment attached to your body. Symptoms, signs, and ill-defined conditions. So in this field, we talk a lot about Gulf War syndrome with Persian Gulf era veterans, and many of the same concerns in terms of environmental hazards are presenting themselves with these latest conflicts. And it is the second highest concern that people may have. And those things may show up in respiratory concerns, gastrointestinal complaints, allergies, skin rashes, so all sorts of things that can't really fall into one particular category, but pretty significant in terms of need. And then the third most common is mental health disorders, very close third at 58.1%. So when I started my yoga and meditation program at the VA, it was a process. It was not actually my intention. I just wanted to be able to go through yoga teacher training for my own bucket list. And I have the pleasure of being friends with the PTSD clinic chief. She's also, at that point, I think she may have been my supervisor. And we were taking care of our health and going for walks. And I was telling her about my yoga teacher training and what I was learning. and how I could see this benefit of an adjunctive practice to trauma-focused therapies. She said, fine, I'll give you an hour. And the mental health service chief at the time said, I will also give you an hour, but I would like to know, like, what is the data that exists about this? And, what are you hoping to get out of it? He was, helping me build intention. What was the whole point of it all? And so I did a lit review at that time. And since now have looked at newer sources as policies have changed, as we'll talk about in a little bit. There's definitely more and more interest and information around CIH approaches in the veteran population. But the key points that came out in 2016 before I started this program were that low or moderate evidence existed for yoga's impact on chronic low back pain, that for low back pain, yoga was associated with the improvement of pain scores and back-specific disability. For depressive disorders, yoga was associated with the improvement of depressive symptomology. There were few adverse effects. Really, what do you have to lose in order to offer a yoga program? And the quality of existing systemic reviews were generally good. So with that, as we move forward into the more present day, as more and more information has come from this, evidence suggests that complementary and integrative approaches are effective in reducing PTSD symptoms, depression, anxiety, increasing mindfulness and sleep quality, and looking at movement-based complementary and integrative health therapies. So Qigong, Tai Chi, yoga, participants described improvements in all realms, improved physical and mental health, reduced opiate and psychotropic use, enhanced emotional well-being, and better social relationships. And again, another bucket in the for yoga camp, a reduction in PTSD symptoms, less fear of physical activity, and less social avoidance. So here we are at our next poll question. The top presenting concern for post 9/11 veterans presenting for care is mental health. True or false?
So again, while they are answering, I have one question for you. Is iRest free or is there a cost?
So the iRest is free, the training or the class itself. So here at the VA, all of the complementary and integrative approaches that I teach are free for the veteran. There's no cost associated or copay associated with care. And actually, talking with other insurance companies, if the therapist is providing therapy in the setting and they are integrating yoga and meditation into the approach, it is covered by health insurance based on the diagnosis of the person you're treating. The training is a little less than half of what a rollout training would be. So if an agency is saying, like, we support CBT, but we're not going to support this, the cost associated is less than half the same investment. And hopefully that answers the question. If not, I'm happy to help with clarifying that.
Yeah, no, and Alicia, I know you're the one that asked that question. Feel free to clarify in the chat if that did not answer your question. But here are the results from the poll.
Okay. Oh, okay.
I knew that.
Come on, people. I know it's so hard to not be distracted in this day and age. All right. Okay. So just in terms of a couple more slides related to complementary and integrative health in the veteran population. In this context will make a little bit more sense in a little bit, but so there was a review of all of the different VA facilities who were offering these CIH modalities, and they took a point in time count from 2002 up to 2014. And the integration and growth of yoga was at 13.7% compared to the other modalities, with mindfulness and meditation the second at 3.1 times. And the top reasons for yoga within VA are optimizing health and well-being, mental health, and musculoskeletal pain, back pain, and headache, with some others listed here. My own unpublished, qualitative data in terms of the veterans that seek the classes that I teach here often are looking for just a regular accountability to themselves, to be able to stretch and move better, to feel calmer and get rest and relax. And I don't kick anybody out. So a lot of the approaches where in other VAs, they might test it as like a dose of yoga or meditation. They'll say like, we're going to have a 12-week cohort and we're going to, see how they do for 12 weeks. I feel like that's really counter to the idea of Sangha and building community in yoga. And I don't kick anybody out, and no one has said I've had to. And I fortunately haven't run out of space. People through attrition might stop coming. And then there are people who have been coming since I started the program in January of 2017. So yoga and meditation specifically is these two CIH approaches, and why with our veteran population. So if we think about, what we know of the Hippocratic Oath of first do no harm, that is ahimsa. That is the first yama restraint in yoga. So as medical professionals, they're already taking an oath to first do no harm. We know that that is not always the case in healthcare systems, but if we go back to our roots, we understand why people go into healthcare in the first place. They really should be in alignment with that first do no harm restraint. And actually, in looking into the Hippocratic Oath, albeit that's also something that came around BC time frame from Hippocrates as a physician, there's actually no true source of where that came from. And my guess is that's because over time, you start to borrow, or albeit steal, things that have existed for thousands and thousands of years. And it's my guess that Hippocratic Oath probably was based off of that yama of yoga, ahimsa, nonviolence. Yoga is a full systems approach, as I've mentioned. It's mind, body, spirit. And when you're trying to convince physicians and psychiatrists of what it can do for the body and the mind, each movement can work to stimulate and regulate all systems. All systems go. And invites what cardiologist Herbert Benson calls the relaxation response, which counters the fight or flight response. So we're working on bringing balance back to the parasympathetic and sympathetic nervous systems. As I mentioned with iRest, it's an opportunity to invite and explore the koshas and all these layers of who we are and how we show up. One big thing, so one big aha moment for me as a social worker, before, I came into the work of social work, doing more macro stuff. My journey took me to doing more individual work. And then I got real individual by doing individual therapy and things like that. And a lot of that was helping people recover from homelessness, substance use, mental health recovery, reintegrating back into their community, whether it was prison system or the system of service from the DoD. And our role as case managers and people are helping support people is, get back out there. What are your social relationships? What groups could you join? What's your access to grocery stores, or what's your access to all of these different things where this, a lot of the focus of reintegration was external. In fact, 100% of it was external. And that's how you define success, right? So how are people doing based on how they're connecting to their community? And when I went through yoga teacher training and meditation training, I realized that our bodies are communities. They're our first communities. And in order for those external relationships to make sense and for those external relationships to work effectively, we do really have to focus on this internal work, this internal system and community. And how are things going? And what does that community look like? Is it walkable? Is it bikeable? Is it taking in good nutrients? Is the environment conducive to thrive or just feel like you're surviving? And how might mindset play a role in perpetuating that narrative, whether it's truth or whether it is perceived? If you're familiar with the chakras or the energy system within the body, yoga certainly, there are postures for each chakra that help to stimulate and help the body recover from blockage, that can really help to free up all sorts of things, especially those concerns that pretty much most of the population could agree with: sleep, digestion, movement, breath. And, with the VA, meditation and yoga were really a good answer for a reduction in opioid and prescription drug use. And I think years ago, when Detroit was looking into their yoga program, the chief of the pain clinic came to speak to our VA and had shared that they'd seen a $9 million reduction in prescription drug use costs with the intervention of yoga medics, which is a type of yoga training that you can do to help with mobility. It's a lot like physical therapy and yoga therapy. So now we're moving in to, we took the lens really into this idea of these CIH approaches, how it connects to social work discipline and practice. And now I want to draw the lens back out, big view. The whole health initiative at VA is one that is about a transformation of the healthcare system. So healthcare in our country is disease management. It is reactive. It is, find it, fix it mentality. And the whole health initiative is really to see people as whole people. And it's an approach to healthcare that empowers and equips people to take charge of their health and well-being and live their life to the fullest. So we're going to spend some time talking about this. And this feeds into a tool that can be used both personally and professionally. Because in order for us to show up for the people that we're serving, we have to do some of this work for ourselves. It's just imperative for our own health and well-being. And that's how we show up better for the people who rely on us. So the idea is that you are working on creating a health plan for yourself. And that dark circle in the middle is that personal health plan. And we'll talk a little bit about what that involves, but there are these three areas. And the first is empowerment. And that's partnering with veterans to discover their mission, aspiration, and purpose. So if we relate that back to yoga and meditation, that's your intention, that's your heartfelt desire. And that begins the foundation for this personalized health plan. And then you have, two types of opportunities, whether that's well-being, self-care, skill building support, whether that's a complementary and integrative health approach, whether that's health coaching and peer or partner support. And then there's the other arm of whole health clinical treatment, outpatient, inpatient, health and disease management, utilizing the whole health, personalized health plan, complementary integrative health and health coaching. And as part of case management coordination here at the VA, and having worked in other systems where you're working towards a system of recovery-oriented care, health coaching is a really great model for that. You're working in this facilitative role without judgment. There's, a huge component of motivational interviewing with it, but you're not the problem solver. You're sitting with where things are at and how things are going. And then you look at this inner ring of the healing environment and then the outer ring of the community, and helping for ourselves and helping for the people that we're serving assess where things are at with that system that you might be within, and the community at large. So I had mentioned that I had had those conversations with my then boss, the PTSD clinic chief, about starting this yoga program, and that was in 2016, and we started it in 2017. And in June of 2017, the VA actually passed this directive of approved health approaches, and list 1 are all required. So the VA, either at the individual facility or within the region of where a veteran lives, must offer acupuncture, meditation, Tai Chi, yoga, massage for treatment, guided imagery, biofeedback, and clinical hypnosis. And then list 1 is not required, but it's approved, and kind of in that same mindset of it's not going to hurt anything to offer these approaches. The one missing from list 1 that was already approved years ago was chiropractic care. So veterans should have access to all of those list 1 approaches, either within VA or within the community. So I was ahead of my time in terms of starting that yoga program. This is the same model, the circle and like flower pattern there, that same model that was in the last slide of looking at the pathway. And so these are for VA purposes, the components of self-care. There are 8 of them. And I am not afraid to say, this is the 8-limb path of yoga. And so, you know, this model of whole health for VA's purpose was, you know, started 25 plus years ago at Duke University. A physician birthed this model, but again, you know, in the lineage of appreciation versus appropriation, I'm quick to point out that this is the 8-limb path of yoga, and these are all the ways in which yoga can fit into these components of care and self awareness. The idea is that so thinking about yourself as the practitioner, as the staff, as the person who is the focus, especially right now, if you're thinking about continuing ed, you are the focus here. And you come into this work with mindful awareness. So that is present in the moment without judgment. The without judgment piece is always the kicker for me. That's sometimes really hard. And then clockwise from 12 o'clock, moving or working the body is the first component. Then surroundings, then personal development, food and drink, recharge, family, friends, and coworkers, spirit and soul, empower the mind. So there's a way for yoga to fit into all of these, like the 8-limb path. So I just wanted to point that out. And then the darker circle of blue is prevention and treatment. So what are the complementary and integrative health approaches? What are the conventional approaches that might help to address where people are at with each of these things? And then that outer ring again is community. So it's really important that the people who are working with our veteran population and the community at large are aware of what is going on in that community. I know that this has always been a qualm of mine, that, you know, cost of living and perception might impact where people live, and that might be different than where they work. And it's just an important piece of cultural competency for me. I am going to share this video interview. This is Dan Nevins. He will talk a little bit about his experience in the short interview, but I came across him while I was doing my yoga teacher training. We had to do a 100-hour project, specifically creating a yoga program for a population, and I wanted to use that time to build a program that could help with working with the population that I was working in, with close to 9/11 veterans. And I came across him, and he's really just been an inspiration to me. I actually had the chance to meet him a couple years ago. He came to Canton and did a yoga class, and it was one of those experiences where, like, okay, I am complete. I could die tomorrow, and I've done what I need to do. So hopefully, if you have the opportunity right now to listen to his words, or if you wanted to find him later, I know these slides get shared for all. So let me just stop the share of the slides. And where did it go? Did I close out of it? No. So to here. Hoping this works. Do you see a YouTube screen?
Yes.
Okay. All right.
The federal government has designated this National Yoga Month. If you have any doubt about the good yoga can do, listen to our story with a twist from Elaine Quijano.
Spark your toes, like fire them up.
Dan Nevins commands his yoga class with authority.
Start to create the inner fire right now.
But for Nevins, teaching yoga is much more than a job. He says it actually saved his life. 11 years ago, while serving in Iraq, an IED exploded under his Army vehicle. The blast destroyed both his legs.
I just remember having this revelation, like I'm alive, that I better do something to keep it that way.
He spent 18 months at Walter Reed Medical Center, and with the help of the Wounded Warrior Project, he learned to climb mountains and play golf. But 2 years ago, while recovering from another surgery, he was bedridden and started having flashbacks.
And those thoughts of the not so great experiences from combat just kept coming back. And I didn't get to the point of suicide, but I finally understood it in those 8 weeks at home. And I knew that I needed help.
A friend suggested yoga.
I was like, no. 1, I'm a guy. 2, I'm an Army guy. 3, I don't know any spandex. And no.
He finally relented and took the class.
And I got in this warrior 1 pose. I rooted down, and I felt this real surge of energy from the earth up into my body and like into my soul. And I shot up, and I was like, oh my God, I get it. It was like the earth was saying, where have you been the last 10 years? Inhale.
Last year, he completed yoga instructor training.
It's this infinite source of energy, and what I'm telling you, you can plug into it.
Now hundreds of people come to his classes.
And I felt, if he can do it without legs, like what's my excuse?
Happy baby pose. Hands.
Nevins hopes to reach both veterans and non-veterans alike.
Namaste.
A warrior on a mission to save others. Elaine Quijano, CBS News, New York.
All right. So that's Dan Nevins. Yeah, pretty inspiring. And he's got a lot of other interviews, and I think even now at this point, some TED Talks. That interview is from 2015, so he's making his way. I follow him on social media. He's on Instagram, so he's got a lot of great wisdom. All right. Going back to our slides here. So what I appreciated about Dan's message is that and this is a quote from him, I had this realization that the most life-saving part for me was not being in a class full of veterans. So that's not necessarily, the end goal, but no longer feeling like I was different because I was a veteran. And I think that goes back to the sense of non-separateness that, he has said this in other interviews and talks before, like if you want to help a veteran, invite them to a yoga class, but it could also be invite them to go on a run with you, like Team RWB, invite them to, do something that will help them feel connected and not separate. Back here. So coming back to that personal health inventory, and this is just a time for us to welcome reflection, which we don't often get an opportunity to do in our work or in our day. And so I want you to take a moment. We're not going to go through the whole thing, but I want you to take a moment, and whether that moment is just thinking or whether or not you want to write this down, I'm going to ask you the question, what really matters to you in your life? And just like I asked, know if nothing comes to mind, that's okay too, but just invite the question. And then the second question is, what brings you a sense of joy and happiness? Remembering that joy and happiness are not something that you have to strive for or do anything for. It's not like you have to deserve it. You already have it there for you. It's your birthright. So what brings you a sense of joy and happiness? And then we're just going to make a quick little scale for yourself. Love scales. And think about this as a scale of 1 to 5, 1 being miserable, 5 being great. Where do you see yourself on the scale for your physical well-being? Remembering that you're showing up present without judgment about where you're at with physical well-being. And then where are you at with your emotional or mental well-being? I know in this last year, it's changed sometimes by the hour. So just right now. And then life. How is it to live your life day to day? 1 being miserable, 5 being great. Now I want you to think about the last interaction you might have had with a colleague or in a meeting or with a person that you're working with individually, or it could be a friend or family member. And you've got just 5 minutes. I've actually started doing this all the time, no matter what, coming into a conversation with wanting to know what we both want to get out of it, especially the person that I might be talking to and inquiring with. If you just had a few minutes asking that person, what is the best possible outcome of our time together, or today's visit if it's in the context of a setting that's more clinical? Or you could say, if you left today's visit satisfied with our plan, what is 1 key thing we would have addressed? And a follow-up for either if there's any need for clarification. Reiterating that you want to hear what's most important to them, typo, and how you can meet their needs. And that is often a question that gets met with this, like, well, I don't know. But it could be a real revelation. And this is a much different sort of way to approach that same sort of question of, why are you here? What's your presenting concern? You'll get to that information, but what do you want to know? What do you want them to tell you about what you should know about why they're here? And this is one way of changing the conversation. So I want to just give you that, 1 for yourself and 1 for those around you. And here we are for a poll question. A positive approach to patient or system care is centered around the patient system, proactive, personalized, or all of the above.
We have a couple questions that have come through. Do you want to address them now, or would you like to wait till the end?
No, that's great. Let's do it now.
Okay. The first is, does the biofeedback requirement include neurofeedback?
Not right now that I know of. But as someone who's had biofeedback, I mean, that's really just a question of where they might place the little nodes. So it's my understanding, like in neurofeedback, it's your brain, and pain sensations where I've had biofeedback is in my low back. But it would be really, I think you could make the argument for neurofeedback to be included in biofeedback.
Another one is, with regards to service delivery, are offerings and programs available? It says AILL, all caps. Does that stand for something?
AI.
And then it says vets who are wounded physically, emotionally, or as a part of general well-being.
Are services offered to those veterans?
Mhm.
Yes. So I've had, that's, sometimes when someone will talk about a referral, they'll say like, well, I am on a scooter or in a wheelchair, or I can only sit, I can't get down on the floor. And that to me is not a limitation. That to me is an opportunity for me as the facilitator of this experience to figure out how to meet them where they're at in that moment. And other abilities will get theirs too. Like I did an additional teacher training in yoga for all. So looking at all ages, all abilities, and all sizes. And that really helped to solidify to me that it's my responsibility to show what is possible. And that's in my opinion, every yoga teacher's responsibility. And so I had mentioned this before, breath is movement in the body. And as long as we are breathing, we are doing yoga. So if you can only breathe and you don't have access to movement in any other part of your body, you can practice yoga. Or I'll have people who might feel like they just can't in terms of the physical practice, but they really just want to rest. Showing up, rolling out your mat and laying on it for 60 minutes, that's yoga too. You're doing what is for you. And that is the whole point. So I'd say yes. I don't know what that acronym stands for, but
it looks like she clarified just now that she did just mean all vets.
Oh, okay. Yes, all veterans caps. AL.
And then before I share the results, we have a great comment. So this person said, I developed a yoga program at the alternative high school I work at with the Plymouth Yoga Room. One of the instructors and I co-wrote and published an article titled Anxiety, Academics, and Ashna that was published in Mindful Studios magazine in 2019. Yoga has made a huge difference for the students that I have worked with.
That is awesome. Yeah, that is awesome. Yay, all the above. All my chiding has paid off. All right. So what is this interweaving with yoga and social justice? What do I mean by that? And I can only speak from my personal experience as a straight white woman who comes to this practice, with my own intention of wanting to just feel freedom inside my body. And I want you to know that, that's the lens in which I see this through. But I think it's important to set intention. And this work has really challenged me to do everything that I do. Every touch point is coming back to this question of why me, why now, what is this all for? And I think especially in times of COVID, when we're challenged to really dig deep into the reserves of energy and capacity, this is an integral and important question to be asking ourselves and to know the roots of the work that we're doing. And I think as social workers, oftentimes, we'll learn the theories, we'll learn the history. And, you know, when you're learning the history of social work practice, really, it comes to mind these images of white women as saviors coming into places and thinking that they know better and that they're going to help. And what we have learned as this profession has evolved over time is that is not always helpful. In fact, it can be very harmful. And that is what I've appreciated about the addition of yoga and meditation and practice for myself and for the population that I serve. And that I can understand the roots of another culture, but it also comes into question of understanding what are the roots of my own lineage that I can draw upon. And, you know, what does it mean when we erase so much of our identity, and how much are we erasing in terms of what connects us versus what divides us? So if we come back to our primary mission as social workers to enhance human well-being and help meet the basic human needs of all people, this is integral to our work. And those core values align completely with yoga. Our service is karma yoga. Our work in social justice is helping to create or reconnect with autonomy of mind, body, and spirit of the self and of the community at large. The core value of dignity and worth of the person. If we walked into every interaction, understanding that we're all whole and complete as we already are, done and done, right? Like that is the underlying premise, and everything else is noise. And we're here to help turn the volume down. Importance of human relationships. We are interconnected and not separate. And the integrity of our work can align with those yamas and niyamas and our ability to have restraint and observance in our environment and not feel like we have to be the expert, not feel like that we always have to do it right, that we can make mistakes, and that's part of being human, but we're doing it with the intention of non-harming. And then competence, what are the roots? What are the roots of who we are and who we work with, and what are we there to do? I wanted to share some other reflection questions from Rachel Ricketts' Do Better, which is spiritual activism for fighting and healing from white supremacy. And this is just, you know, for me, a really great opportunity to share these reflections with you, and also just to keep in mind that when we think about, she's got this great chapter on what she calls wealth and hellness, which I totally appreciate. And, you know, what we see in the wellness world in our country, especially, might not be reflective of all shapes, sizes, abilities, colors. So when you think about big names in health and wellness right now, what comes to mind? What are the cultural roots of those practices they're sharing? Do they acknowledge those roots? And if you were to go onto social media or the webpage of your favorite wellness brands or leaders, what are they doing to promote racial justice and anti-oppression? In my yoga journey, I come to find out a few years ago that the practice of asana is actually very young. It's only a couple hundred years old. And the premise was to be a resistance to British colonialism in India. And they would train young teenage boys in India to do these practices, the asana practices, as a way of resistance. So I think that that's such a powerful message in terms of the inner warrior and in terms of fighting eradication of culture and lineage. And I think it's just really important to honor that when we think about engaging in these wellness practices. And who are the people that you follow or who influence you, who embody the sense of wellness and health, and what do they look like? And why might we thrive to to go toward people who might be more white in a world where these practices are not founded in whiteness. What are 3 ways you could tap into and learn from your own ancestral spiritual wisdom? And as a Polish woman of Eastern European descent, I'm hard pressed to find where that exists. You know people in Poland to be salt of the earth and to eat pierogies, but like if I look up Polish self-care, I don't really know that it's readily available to me, and that's problematic. So that's a question to yourself, but also for the people that we serve. So we have about 15 more minutes, and I wanted to just offer up an experiential opportunity. I was going to put pictures here, and then I thought my, definition of what looks calm and peaceful might not be your definition of what looks calm and peaceful. So I want you to just bring to mind maybe you tapping into that sense of inner resource. And maybe if you're in a space where you have a picture of yourself in that space, or a symbol, or some object to hold your attention, we're going to do a brief meditation and then end with a little bit of movement. So this meditation is written by Gail Parker, who is a psychologist, and this is restorative yoga for ethnic and race-based stress and trauma. And it is an Anandamaya or bliss kosha meditation. Come to a seated position with a straight spine, either in a chair or on the floor. Or like I mentioned, you can also lean against a wall. Find comfort in the surface that supports you. And when you're physically comfortable, close your eyes or shift your awareness to your breath. Once you feel settled in with your eyes still closed or with lids slightly separated, shift your awareness to your physical body. Systematically going through each body part from bottom to top, being very specific. Take your time. Focus your awareness on the top of your right foot, then your toes, then the sole of your right foot. Just feel. Then move your attention upward to your ankle, your shin, your calf, your knee, and your thigh. And move your awareness to the left side and repeat the entire process, starting with the top of your left foot, then toes, then sole of the left foot. Just feel. And upward to your left ankle, shin, calf, knee, and thigh. And when you reach your left thigh, move your awareness to your hips, your waist, your torso, your chest, your collarbones, your back, your right shoulder, and your right upper arm, forearm, wrist, hands and fingers. Next, move your awareness to your left fingers, left hand, left forearm, upper arm, and shoulder. Move your awareness to your neck, back, side of the body, in front of the body, then jaw, ears, cheekbones, eyes, temples, forehead, and scalp. Next, turn your focus further inward and direct your awareness to your brain, the inside of your mouth, your esophagus, the lungs, your heart, the diaphragm, your liver, spleen, pancreas, stomach, the intestines. Once you've completed your external and internal scan, invite your imagination to envision yourself as a dove. The head of the dove represents joy. The right wing of the dove represents love. The left wing, delight. The body of the dove represents bliss. And the entire body of the dove is encased in and held by consciousness. Resting here for a moment longer. And if the mind distracts, you can always return to the breath or feel a sensation of the surface beneath you. Mind and body at rest. Let's move into a gentle movement practice, attending to the spine and noting that, again, you could sit or stand. And you could even practice with eyes remaining closed, maybe feeling into the felt sense of each movement. Or if your awareness is with eyes open, then eyes can open. And we'll bring hands to heart center. If seated, feeling the floor with both feet. If standing, same. And on an inhale, we'll bring the arms up through center, up overhead. Elongating, dropping the shoulders, bringing that right hand down to your hip and your left arm up and over, side stretch. You can always bring your hand to your shoulder, or even bring your left hand back down to your hip. Inhale back through center and exhale here. Lifting that right arm up, out, and over. Side stretch. Again, maybe hand rests on shoulder or back on the hip. Inhaling and exhaling back to center. We're going to take the hands and cross them very gently across the body. Take a breath here and inhale. And as you exhale, just take a gentle twist to the left or right. Just moving in the torso, or even just the eyes can move from one side. We'll take a breath here. Inhale back through center and exhale, twisting in the opposite direction or gazing in the opposite direction. Inhaling back through center, exhale, release. And feeling into that undulation, or feeling the spine as like a snake, ebbing and flowing. We'll just do a seated or standing cat-cow stretch. And I'll turn to the side. On an inhale, shoulders back, eyes up, heart opens. On an exhale, rounding the shoulders forward, feeling the eyes come down to the lap or floor. Inhale to open. Exhale to round. Inhale to open. Exhale to round. And coming back to center. So that's the 7 movements of the spine. You can do it seated, standing, laying down energetically with your eyes up, down, right, left, forward, back. So that closes the experiential practice, and there's lots of resources. I think I actually have more also within the slides as well, but here are some. And we've got a couple minutes left for questions. And I'll turn my camera now that I can see you again, because I had the camera off. I can see how blotchy and red I am. That's just me being excited.
Well, thank you so much, Sarah. We do have just a couple minutes left. If you guys have any final questions, please do put them in the chat or the Q&A. You will receive the slides when you guys receive your CEU evaluation. Comments are coming in quick. What was the name of the book that you read the meditation from?
That is Restorative Yoga for Ethnic and Race-Based Stress and Trauma. Gail actually lives in Michigan, and it's one of my next bucket list goals to meet her. She helped to found a yoga school at Henry Ford Hospital. So I cyberstalk her as well.
We also have another really great comment that says that you have such an amazing calming effect, Sarah. Keep it. I would have to agree. That was very relaxing.
Thank you. Hopefully it was relaxing the whole talk and not just the last 5 minutes.
That's what one person actually joked in the chat when you were joking about there being distractions. They said, maybe not distractions, just your calming voice.
Oh, thanks, everybody.
All right. Okay. Well, it doesn't look like there's any final questions. I take that as a positive. You touched on everything. So just as a reminder, everyone, and Gabrielle Usuli, congratulations, 25-year anniversary from the UM School of Social Work. Awesome. But please do keep in mind that you'll receive your evaluation for your CEUs in maybe a week or so. If you have any questions regarding CEUs, please do email, I'm going to put it in the chat, our continuing education office. If you send an email to me, I'm just going to send you straight to them. The CEU evaluations do not come from the Office of Development and Alumni Relations. They come directly from the continuing ed office. So thank you very much, everyone, for joining us. And thank you so much, Sarah. I hope everyone has a wonderful day.
You too. Bye-bye, everybody.